Hairbrush.
So formal.
I know. I think, when they come in, they think vaginal rejuvenation, they think, tightening, but they're also talking about incontinence, and then also sometimes aesthetically, like the look of the vagina as well. But when I think you're truly thinking or talking about vaginal rejuvenation, that when I think of it kind of from like a technical term, it's actually just really the tightening of the vaginal opening.
And kind of reconstructing the vagina to what it was prior to pregnancy and or delivery. So I would say that vaginal rejuvenation most commonly is requested by women who have had deliveries, specifically vaginal deliveries. But we do have some women who come in that look for vaginal tightening or maybe want to change the appearance of the opening of the vagina. And that appearance can change, or the function can change over years due to non-pregnancy causes.
When it comes to vaginal rejuvenation and exactly what type of procedure patients are candidates for, it's all based on each patient's individual anatomy and their exam. So even though a patient may come in and say, oh, well, I've noticed I've got a little bit of laxity, if we go in and do an exam and we don't really see a lot of laxity or we don't see a lot of relaxation, then they're gonna typically be more of like a laser rejuvenation candidate. When they have larger relaxation or even prolapse, which is actually a weakening of the musculature within the vaginal canal, which allows the organs within the vagina to prolapse or start bulging inside the vaginal canal, that's when we start talking about a more permanent or definitive treatment option, which is typically surgery.
I would say, so the risk associated with either treatment are going to be pretty different. From a surgical standpoint, you come with the standard surgical risk, which is going to be like damage to surrounding tissues or structures, infection, pain. From a long-term risk standpoint, these types of surgeries rarely ever come with long-term pain. That would probably be the biggest thing that I would think of, which would be a significant.
That'd be pretty rare.
Yeah, that's pretty rare. And then, there's always the risk that either it's not tight enough, and then even more uncommon, that it's too tight. Yeah.
So ThermiVa, you're back to normal activity same day. You can even be sexually active, doing whatever. Post-treatment, you may feel like a little warmth, within the vaginal canal, but there's no downtime post-procedure for that. With rejuvenation, if we do surgical rejuvenation, you're looking at typically, so for those procedures, you are in the hospital usually overnight, and then recovery is 2 weeks where you're kind of the most uncomfortable period of the post-op phase, and then 6 weeks where it's full recovery, where you're back to 100% normal activity, including intercourse.
I would say probably the most important thing if you're looking for a surgeon to perform a vaginal rejuvenation evaluation and or surgery is that they are a urogynecologist, because they have specific training and expertise in the function of the vagina and the pelvic organs and how they all work together, and that's a pretty critical portion in terms of reconstructing the anatomy in a way that's functional.
Along those lines too, so urogynecologists, because you'll go out and you'll find, you can look all over like online for people who do rejuvenation. Some gynecologists will do it, plastic surgeons. There are a lot of different specialties that do offer rejuvenation type procedures. But again, like finding somebody who actually understands the anatomy and kind of the cause and effect kind of associated with all of that. Not only that, I even tell patients, like when they come into our clinic, like we want you to be comfortable with us, you know, like not everybody vibes with everybody, maybe you have like a bad experience, like maybe you had a bad day, maybe we had a bad day, there like things happen, anytime you come into a clinic. Obviously we try to not kind of, have like an instance where that occurs. But I always tell patients, like, if you're ever like on the fence about coming to us, or like you just don't know, or you're kind of like, I don't know, I always recommend, like, go get a second opinion, go see what somebody else says. Just because you've had a consultation with one surgeon doesn't mean you can't just get another opinion or see what somebody else says. And then sometimes that's enough if you're on the fence to kind of say, I feel really good about this surgeon. Like, they clearly know their stuff. Like, I feel good about their office, like the way they present themselves, the information that was provided to me. And honestly, I think that's kind of a lot of what sets us apart, from a lot of other providers that do these types of procedures is, I feel like we go above and beyond with our patients in educating, in the pre-op, post-op care, all of that.
Yeah, the education is a big factor. So this isn't most of the time, these aren't minor surgeries. So you want to make sure you find somebody that's actually educating you through what's being done and what to expect in the post-op period, because it's not like a, in and out type procedure.
It's not like you're getting Botox
and
then going home the same day.
Really kind of understanding what benefits and also risks that you're taking, and having a providers that are going to spend the time to go through all of that with you is really important.
So the only time a surgical vaginal rejuvenation potentially could wear off is if you had another vaginal delivery post-surgery, and that would essentially undo everything surgically that had been restored. And then also what we find sometimes is patients who have chronic constipation. If you're constantly straining, bearing down, things like that, it does put stress on the pelvic floor. So potentially that can contribute to recurrence of relaxation. And sometimes connective tissue disorders too can also contribute. I would say that's more of like a rarer instance, but that can also contribute.
So to prepare for ThermiVa, there's not a whole lot the patient has to do. You're going to want to undergo an exam with the provider first, just to make sure there's no contraindications. You want to make sure that you don't have an active urinary tract infection, you're not dealing with like a vaginitis of some sort. And then if you have a copper IUD or any metal within the pelvic area, those are all going to be things that the provider should hopefully be talking to you about, and because those would all be contraindications to the treatment itself. Otherwise, I usually say come in well hydrated, and it's a highly tolerated procedure. Risks are really low, and there's nothing really to do afterwards.
There's a lot that goes along with preparing for surgical vaginal rejuvenation. One, exam, obviously, that kind of helps us determine exactly procedure-wise what's recommended. And if you are a candidate for surgery, there's bowel prep associated with it. Prior to surgery, you won't be able to eat for a little while. And then really those are kind of the main things. Depending on your health status, you may have to have lab work, EKG. If you're on medications, potentially, sometimes you have to discontinue some of those.
Yeah, and make sure to plan the surgery around a time period where you're really going to have a 2-week downtime, right? To give your body the time it needs to recover. I think that's really important.
So in terms of coverage for vaginal rejuvenation, ThermiVa is not covered by insurance. That is considered technically a cosmetic procedure.